Hello, I'm Dana Soper, CEO of CORDENTAL Group, located in Cincinnati, Ohio. And we are a regional DSO that has 48 sites of service in 9 different states. That in and of itself presents a very unique challenge as we try to keep up with state and federal guidelines associated with COVID-19. CORDENTAL stands for Collaboration, Optimization, and Respect. And when you look at our planning process associated with reopening, it was all those things that we took into consideration. It really brought us back to our core values. Being a DSO and having different team members in different areas, it really allowed us to take into consideration kind of everybody's point of view of how we needed to bring this together to make it work for everybody. So we ended up with about a 45-page document that was our restart plan for the company as a whole. And then we had another document that was probably about the same size that was specific to the workflow in a practice and how we had to move patients through the practice to make sure that everybody was safe, not only within the 4 walls of the practice, but also the patients that were coming into the practice for dental care. As soon as we closed up the offices, we came up with what we call a dormancy plan. And so how we have opened our practices is that for the first week, it was doctors only, along with their assistants and the front office manager. And the reason being is they could work out the kinks associated with all those new protocols and then share those changes along with things that they had learned along the way to the rest of the team members. And so the second week is when the hygienists came in and any additional team members that we needed based on patient demand. What we have found as we have opened up is that the schedules have been robust. A lot of dental care was put off for the 2.5 months that we've been closed. A lot of emergency care got people through this time period, but really didn't address the real need and fix the problem. And so that is being addressed as we speak. And obviously, a lot of people understand the importance of dental health care. And so a lot of folks are ready to get back for their hygiene appointments and get those taken care of. So we've seen our schedules full. We've seen them robust. And we are appreciative of our patients and their willingness to come and see their dental health care provider. If there were lessons that we've learned along the way, there's definitely things that accelerated our move to embracing technology. We moved to online scheduling, something that we had been talking about but yet hadn't accomplished up until this point. We also looked at online bill pay, which was not fully implemented throughout the organization, but is today. And then something that's been very advantageous for us is we took advantage of those systems that we already had in place. Our intranet was more widely used for communication purposes internally within the organization. Our email systems, we have Outlook and so team chat and the ability to have conference calls online. And all of those things, I think, helped us be ready to reopen and have a positive response from everybody involved. One of the things that I've realized during this time is that the dental industry as a whole is very collaborative in their nature, very sharing of information. And overall, the goal has been to make sure that the industry as a whole does what we're supposed to do in taking care of our patients and our team members. And I found it very rewarding to be a part of this. So hopefully what I've shared today will provide you some benefit and help along the way. And if there's anything I can ever do for anybody that may be listening, I'm always available and here to help as we advance not only the industry in the light of being a essential healthcare provider, but as we take care of our patients now and into the future.